There's several reasons why endometriosis tends to get missed by OBs so often. The first is a function of the healthcare system. Often, OBGYNs only have maybe 15 minutes with their patients at either a problem visit or an annual exam, and that is not enough time to really dig deep into what a patient's complaint is, what their diagnosis is, and then discuss treatment options. The second reason is that often patients are coming with a primary complaint of either painful periods or some other condition involving their bowel or bladder, and the focus becomes on treating those symptoms either with a birth control pill or an IUD or a referral for GI treatment or urology treatment, rather than focusing on what is causing those symptoms. So often the gynecologist is focusing just on, well, okay, this patient is having symptoms, how do I treat them? The third reason is that the diagnostic methods available for endometriosis are limited. In non-expert hands, it's difficult for an OBGYN to be able to diagnose endometriosis just based on ultrasound or pelvic exam. The gold standard diagnosis and treatment of endometriosis is laparoscopy, which is often not within the skill set of the OBGYN to be able to go in, diagnose and treat endometriosis at the time of laparoscopy. The fourth reason is that a diagnosis of endometriosis or having a label of endometriosis is often something a gynecologist does not want to give a patient because it opens up a huge can of worms. What does this mean for my fertility? What does this mean for the future? Am I going to need surgery? Am I going to need a hysterectomy? What is the long-term consequences of endometriosis? Which again we discussed. Often gynecologists have a 15-minute window to complete a visit. And so opening that can of worms by giving that label to a patient is often something they want to avoid.